Good morning, everybody. Excited? Oh, am I excited? Just getting ready to see a patient about anxiety, depression. I don't even know if I should really share it. I had to do a COVID test. Whatever they are makes me kind of worried. Good morning, everybody. Today is a beautiful day. It's sunny. There's no snow. Seems like I'm the last one from the house to leave. The last car, so it's not too bad. Getting ready to go. Third week. Excited? Oh, am I excited? You know, I'm not excited, but like I'm looking forward to it. It'll be good. I really enjoy getting some practice, learning, seeing new patients, but you do kind of drain your energy. Like first week is a little bit anxiousness and you start to pick up the pace and understand things, but then like waking up at the same time, you know what to expect. It's going to be a long day. That kind of drains your energy as you know what to expect. So, but I try to maintain a positive mindset. I enjoy talking to the doctor as well and working with him, so it'll be good. Third week, I have 3 total to go for family medicine. All right, halfway through Monday. It's been good, seeing lots of patients, going by quicker. Just getting ready to see a patient about anxiety, depression, which is very, very common, unfortunately. So a lot of people feel anxious, want some medications. During COVID, apparently grew the amount of people that need it. So getting a lot of practice with psychiatry and family medicine. Alright, so the other day my brother ordered this kind of rug for his baby room because they're expecting. So I drove over to bring it to him. Try to show you. Tadji! Tadji!
Comprou a lixeira agora.
I don't even know if I should really share it because the situation is so specific that like you'd be able to find out who this patient is if you ever heard the story on the news or something. But very sad, and I just want to say that in family medicine, every patient's like a novel, and you're learning and reading about each novel, each story, and there's so many unique stories out there. Some are interesting, some are sad, some are happy, and some are just normal, not, you know, kind of the average person, but very interesting what you come across in family medicine, in medicine in general. Alright, I have a snow squall warning or something. Today, it's hailing. I have to move my friend's car. It's blocking the driveway. I got to do my first TB injection where you put a little bleb on the arm. Pretty straightforward, pretty easy. No bleeding. Proud of myself. Now I'm just waiting to present a patient to the doctor. Alright, just saw a patient that had their foot ran over 2 years ago, and ever since starting driving a couple weeks ago, her foot's been hurting more and more after 30 minutes of driving. So I think we should do an x-ray, but I don't think it's really going to change the management. If you had your foot ran over a couple years ago, there isn't much you can do because surgery would be worse, so it's a hard place to be in. Alright, so I'm waiting for the doctor. I saw a couple patients. I did a well baby exam for a 6-day-old. I say this every time, but like walking clinic is exhausting and just non-stop. Seeing patients, coming up with a differential, thinking of how to solve it. And I thought, that's just medicine. I don't know why I'm so surprised, but it's always more draining than you think. And it just comes also with the fact that I'm still like super early in my training, so I don't know the answers, so I have to think through a lot. Some of it can be overwhelming, but after years of practice, I'm sure it gets easy and it's routine. I wanted to say that. All right, it's the start of a new week. So over the weekend, Jess drove down from Ottawa to celebrate her grandpa's birthday. So we had a fun time with her family. Just arrived at the clinic and it's already looked at the patient list and it's pretty busy. First 2 patients are for anxiety and mental health coming up again and again and again. And so hopefully today will be good. So this is my last week with the doctor I'm currently working with. And then next week, I'm going to be working with a different doctor who has a different type of schedule. So that'll be a change up in routine, a change up in patient population as well. So today is one of those kind of third winters. It snowed this weekend, so hopefully it'll melt soon. I don't really like the snow. Today's gonna be good. Let's go. so I came to work earlier today to go to Life Labs to get blood tests done, and it's really convenient because Life Labs is literally right across the hallway. So I came in, literally waited maybe 2 minutes, and already had it drawn. So now it's 15 minutes till clinic starts today. Be good. Getting towards the end of the rotation. We have half the week left, and then next week I think I'll be shadowing a different doctor who has a different schedule, so that'll be interesting. So just finished the walk-in clinic with the doctor. Same doctor, same walk-in clinic, but today was extremely slow. We had a couple of no-shows, quite a bit of no-shows, and just less patients overall. I'm trying to open the door here. So it was very calm. The door's not opening, hold on. Okay, so I got in. So yeah, it was a slow day. So I did B12 injection, and then I did just an immunization injection, both intramuscular, so straight into the shoulder. No bleeding, doctor was happy, it was perfect technique. That's good. Looking forward to a couple other patients showing up, but they didn't. It's fine. I don't mind if patients don't show up. More time to kind of just study, look around, or learn around patients and talk with the doctor. So today's done. It's my half day. Gonna take the day off. Gonna eat, exercise, do some studying. So I have 1 week left, and tomorrow I'm with a nurse practitioner. Next week I'm with a different doctor for the variation. All right, so family medicine's almost over, which is crazy. It went by really quick. It was fun. I wish I had more time on it, maybe more half days to actually spend time learning rather than just seeing a whole bunch of patients and not having time to actually download the information, but it's been good so far. All right, I convinced my housemates to order food from Oporto Barbecue, which is a restaurant that my friend owns and that I used to work at. So I'm gonna go drive, pick up the food now, and then come back, and hopefully they enjoy it. I know they will. Alright, so I just arrived at the clinic. Now I'm just waiting for the nurse practitioner to show up, and then we'll see some patients a little slower. 30 minutes each patient, a couple of physical exams. And what that just means is that we check every single system of the body, so it's a good review of systems, good practice for me. Alright, so today's been pretty good. I've done 2 full physical exams for 2 patients, including lab tests and stuff. And then I saw one 7-year-old with increased urination frequency of peeing, and a little tricky to figure out, but it's been good being able to continue to practice exams, do prep tests, just have a chat with the patients, get to counsel them, certain lifestyle modifications. I enjoy it. It's good that it's a little bit repetitive, just to kind of learn and solidify that what I already know, and then a review with a nurse practitioner, and she'll point out some things that I might have missed and how to word certain things and ordering requisitions and things like that. So I just have to finish up one more note on the patient I just saw. Just finished lunch, and then we have a patient in 10 minutes. So the next patient I see is for the first prenatal visit, bringing me back memories of OBGYN, and it's pretty comprehensive because I have to, talk about the partner. Is it, first or second pregnancy, any complications before, check all the vaccines, make sure she has certain antigens, and then order the lab work, and so on. So it's exciting. So we'll see how it goes. It's a good review for obstetrical history. All right, guys. Patient might have Actually, she initially could have had twins, but then I looked at the ultrasound results. She has twins, which is exciting. I haven't seen the patient yet. I'll talk to her. Great note, she's happy, which is good. 2 kids. Alright, good morning everyone. Today I'm going to be shadowing a different doctor. This is my last week, and I'm going to shadow this doctor because they're going to do a nursing home. They're working in a nursing home for today. It'll be a nice variation. Change of scenery, change of patience, and learn a couple of extra things. So it's a beautiful day. Hopefully today will go well, and looking forward to the weekend for my 1 week break where I get vacation. Let's see how this goes. All right, so we finished up at the nursing home, and it was really quick. We only saw 2 or 3 patients. Everybody else was okay. I had to do a COVID test, tested negative, which is nice. Now we're back here at the clinic. I'm gonna do a phone call to a patient, and then we have a couple of in-persons after that. So I'm working with a different doctor, and it's pretty straightforward. Been doing it for the past couple of weeks, so it's nice that I'm used to it. I'm gonna call somebody in regards to ultrasound results of their hip, who I think suffered a fall and had some hip pain. They also had a DEXA scan of their bones, and should be good. All right, so I just got a coffee. The next patient isn't gonna be here until about half an hour from now, so I have some time to prepare. But I wanted to say before I forget, I don't want to make a whole video on this, but I just came back from nursing home and just reflecting on it, seeing a lot of elderly patients in such difficult situations, physically, body-wise, mentally, and even like older nursing homes, retirement homes, whatever they are, makes me kind of worried for the future. It makes me sad, obviously sad for the patients, but it kind of increases my desire so much more for preventative medicine, to be able to tell people like this is avoidable if you take care of your diet, if you exercise, like you can choose to live a healthy life and be healthy when you're older. Just because these certain ailments are common in elderly does not mean that you have to have it. A lot of this stuff is preventable. Listen, genetics loads the gun, lifestyle pulls the trigger. That's a saying that I've heard in the past, and I love telling other people. And seeing people, older patients, in difficult situations like that breaks my heart. And I know sometimes you can't avoid it if it's an accident, certain complications of surgeries or medications, but geez, family medicine or medicine in general really gives you a lot to reflect on in your life and how you're going to go forward in taking care of patients. So I just finished clinic. I saw a patient for a headache, back pain, fatigue, kind of overall physical exam, and like a throat pain. So it was pretty straightforward. The cool thing is that I saw a Brazilian patient, my first Brazilian patient, where I was able to speak Portuguese with them because I was born in Brazil. So that was really enjoyable. It was a very pleasant encounter, being able to talk in Portuguese, which always feels different when you connect with somebody from your culture. So that's exciting. I feel like if I were to have my family practice, it'd be really neat to have decent patient population that are Brazilians, because I'd be able to talk in their language, answer questions for those who struggle with the language, and then you have that kind of cultural connection. Although I grew up here, so I'm kind of like culturally raised up Canadian. But anyways, I'm done, so I'm gonna go home and for the rest of the day do some studying. It's nice to finish work after a long day. All right, so I just wanted to say that I just finished seeing 2 patients this morning, and the last patient was about a diabetes follow-up and some urinary concerns. And the really cool thing is that I had to review some ultrasound imaging, x-ray, and MRI results, not the image but just the impression and what was visualized, and I was able to explain each part of what was visualized to the patient in very simple terms, and the patient was very grateful for me being able to break it down and explain in such a clear way, which is a very nice compliment, because I often feel like I don't know enough, I don't know how to explain it the best way. But if you just do it, go step by step, and really it does help to know your anatomy and mechanisms for sure. And being able to explain to the patient, that made me feel really good that this progress is being made, and I'm able to help patients, and they feel just good knowing that there's nothing wrong, obviously, and that I was able to explain it clearly. Then the patient proceeded to give me a list of all their medications and say like, hey doc, or hey med student, do you think I should be on all these medications? And I'm like, who am I to know that? But I looked at it and I was able to go through each medication and just know roughly what they do. Ask them, how are you feeling? What are your symptoms that you're feeling? Any side effects? No? Okay, so then you should probably stick with that medication. It seems like these are all working. If you reduce it, your blood pressure will go up, and so on. So it's really nice to be able to have these conversations with patients and have them understand what I'm trying to relay to them without the medical jargon. So that's really cool. Got some food for myself, and I got a sample for the doctor because he didn't know about Oporto barbecue, so I got him some rotisserie chicken for free. Now you're in the vlog. Quickly. All right, these guys are the U of T students. They'll say something later, but Mark is leaving today, so he actually probably won't say much unless you want to give some advice to pre-med and med students right now.
You guys are doing great. Keep working hard. Dream big.
Done. Dream big. That's gonna be an Instagram post quote. And then the other two will talk later.
Again. I was leaning so far forward. It was so
Not the cameraman. Alright, after our group picture, we came to Centra to eat some Chinese food.
I don't know what it is.
Under 30, you have to get it. Do you agree with that?
Yeah, okay.
So the Chinese food was closed, so we went to another place and we have 30 minutes to wait. We're just killing time at a store here. Just looking at everything's big discount store.
We're both gonna take one because I want a picture. This is cute. You guys look so cute.
Safety patrol.